Hello, my name's Anna Johnson and I'm the lead primary care dietitian for Norfolk and Waveney CCG. I've been asked to come here today to do this video about nutrition and hydration in people with dementia. So as we all know, people with dementia are all very different and the disease sort of progresses as time goes on as well, so it can change from day to day, week to week and year to year. So dementia, we know, affects everybody differently, and some people might find eating and drinking difficult at some point in their dementia journey. So this might change the foods and drinks the person wants to eat and drink or can eat and drink as well. We had a question in the build up to this presentation about taste changes throughout the dementia journey. So this is something that can be quite common and people can start to like different foods depending on where they are in their journey and in comparison to how they were before they had dementia as well. Things can really change over time. So it's really important to sort of stay flexible with people that are under your care with dementia to make sure that you're meeting their needs and giving them the things that they like. We know this can be really challenging for those who are caring for those with dementia. So really this presentation is to hopefully give you some encouragement and support to support them and meet their needs. Really important for people who look after those with dementia to recognise problems early on with eating and drinking and make sure that you're getting the right people involved, because it's really important to prevent eating and drinking problems rather than recognise it far down the line. So, a few different eating and drinking problems that can happen with dementia. Having a short attention span. So you might recognise that people with dementia find it a bit difficult to concentrate for long periods of time for eating and drinking. So, for example, at meal times, they might only be able to sit still for short periods of time before they want to get up and do something else. Reduced feelings of hunger and thirst as well. So this is really common and is actually a symptom of progressing dementia. So losing that connection, the biological sort of connection with having that feeling of being hungry and thirsty, and that translating into behaviour of eating and drinking. Taste changes, again, as I preempted on the last slide, taste changes are really, really common and might involve things like the preference for different types of food compared to when they didn't have dementia. So for example, sweet foods, maybe stronger flavours as well, because it takes a little bit more to stimulate the appetite and the taste buds. And sometimes just wanting completely different foods from how they were when they were well as well. So we've heard examples of people who have been lifelong vegetarians, you know, suddenly being offered meat and accepting it. And this is a bit of a difficult one really, because you have to think of that in the context of the culture of that person and whether they would have wanted that food if they had not had dementia. So really important, if you're kind of, you know, unsure, you know, if there's any religious or cultural preferences that are now maybe not being adhered to, involve the family and friends in that and just decide whether that's the right thing for that person. But otherwise, if it's things which aren't, you know, a problem, then, you know, being flexible and trying new things and kind of trying to roll a little bit with the different taste changes as well. So memory problems as well. As we know, this is one of the main symptoms of dementia, particularly short-term memory. So someone might have forgotten that they've eaten already or think they've eaten already as well. So it could go one of two ways, where someone hasn't eaten but thinks they have, or have eaten and thinks they hasn't. So it could be under or overeating in this case. So lots of sensory problems are reported with dementia as well. So poor vision and also issues with coordination. So motor issues, so using cutlery, picking things up, and actually kind of the physical part of eating that meal can be difficult for some people. Depression and anxiety are also common in dementia, and those concurrent sort of mental health problems with dementia, and that could be due to lots of different reasons. Everyone, I think, is on a spectrum, and everyone does have times where they feel depressed or anxious. But there's also lots of life changes that happen with people with dementia. They might be, new care packages, moving from different care locations, maybe into care homes, losing independence as well and becoming more dependent on others. And that can all have an impact on appetite as well. Swallowing difficulties, so dysphagia. We know that dementia is associated with having these swallowing difficulties, and if someone has this, then they're often advised to have a special diet, a texture modified diet or thickened fluids, which can potentially affect the food choices and drink choices that person has, and maybe the acceptance of those foods as well. It's not quite what they would have liked, so it's all about making sure that we're trying to give them the most enjoyable diet depending on those swallowing difficulties as well. There's also people have difficulty communicating the barriers to eating and drinking. So there might be things like difficult symptoms going on, maybe feeling sick, pain, constipation. We know all those can affect someone's appetite and their wanting to eat and drink as well. And then finally, physical activity. We know that some people with dementia find it really difficult to keep still, and they actually use a lot of energy walking around. I'm sure you're aware of some people, particularly in care homes, who do like to do kind of laps of the wards and things like that all day. So if you imagine, they are using up huge amounts of energy, and we know that that can potentially lead to weight loss. Okay, so this slide is just to show you an outcome of a recent study into a long-term cohort study into people with dementia in West Norway. And they actually found malnutrition was present in 29% of patients with dementia, and that was looking at all different types of dementia. So that's a third of people with dementia potentially having malnutrition or problems with nutrition. And what they found was that was really associated with a rapid functional decline over 5 years. And when they looked at functional decline, they looked at these sorts of things. So the impact on muscle strength, the immune system, mood, mobility, and other aspects of physical and mental health. So if you imagine, this can turn into a little bit of a vicious cycle. So if you become malnourished, you're more at risk of the functional decline. And then if you're losing things like your muscle strength, your mobility, maybe becoming more dependent on others, maybe your mood being affected as well, that is then more likely for you to become malnourished, and then it's just a bit of a vicious cycle really. So really, really important to try and nip this in the bud and recognise problems early on before it gets to a stage where these people are malnourished and really need to have some sort of proper intervention. We would define malnutrition using the NICE criteria, and that's from 2006. So 3 different indicators you can use there. The first one is having a BMI or body mass index less than 18.5. So BMI is a calculation between your weight and your height. So a BMI of below 18.5 indicates that they're quite underweight. Or you can use an unintentional weight loss greater than 10% within the past 3 to 6 months. So as I kind of alluded to in the last slide, if you lose weight, quite a significant amount of weight over a short period, that can have impacts on your kind of functional abilities, so things like your muscle strength, your mobility and things like that, and your immune system. So that can have quite significant clinical effects. Or the third one is a mixture of the two, so a BMI less than 20 plus a greater than 5% weight loss within 3 to 6 months. So that's how we would define it. So really important to treat those that you would identify and assess as being malnourished. So the first one is really to just think about what the cause of that poor nutritional intake might be, or what the cause of them using excess energy might be. We know that losing weight is dependent on the energy that you put in versus the energy that you expend. So like the example I used of someone walking around all day, they might be eating enough, if they were kind of sedentary, but actually once you kind of if that person is doing lots and lots of physical activity, they might actually be burning off more energy than they're taking in. Or it might be someone that has a very poor appetite and is just not taking in enough nutrients in order to meet that need of their body. So what are the barriers to that person getting enough nutrition? Obviously there's going to be lots and lots of different barriers there. It could be people living in their own home, it could be financial, it could be their mobility, or it could be them feeling unwell, having difficult symptoms. So there's lots and lots of barriers you can think about there. In terms of the food that you might get that person to try and have, it should really be a sort of nutrient-dense diet, and what we mean by that is high amounts of things like fats, proteins, complex carbohydrates and micronutrients. So we don't necessarily want to increase the amount of food that person's eating, but we might want to increase the nutrients of the small amount of food that they are eating to make sure it's really packed with all the things they need to keep their body functioning properly. So in order to do that, we might think about food fortification or nourishing drinks, and you might have heard these terms before, but food fortification means that you're adding nutrient-dense ingredients to the foods they're already eating, and nourishing drinks, you're drinking foods with high amounts of nutrients in between the meals to hopefully support that nutritional intake. Finding out preferences, obviously, types of foods, drinks, eating environment as well. So, you know, if you're thinking about someone that's maybe come into a care home, where do they like to eat? Do they like to eat in the dining room with other people? Do they like to eat on their own? You know, what are the barriers to them eating in different places, and what do they like to eat and drink out of as well? So think about those preferences, what types of cups, cutlery, things like that. Manage any symptoms which might be contributing to them not eating very well or not drinking very well. You know, so things like drowsiness, any medication that causes that sort of thing, nausea, any constipation, things like that would be really good to try and manage. And obviously not just on your own, not isolated, and in collaboration with other MDT staff, so multidisciplinary team staff. So you might have healthcare professionals coming in, or you might sort of, you know, involve the GP, friends and family and people like that in order to get the best outcome for that person. And obviously the dietetic services are there if you need them as well. So if you've tried some things at home and they're not working, then making sure the GP is referring to the dietitian so they can come and do a proper assessment and recommend what's needed for that person. The principles of food fortification, as I said earlier, so you want to try and increase the amount of fat, increase the protein, increase complex carbohydrates and micronutrients. Meanwhile, you want to try and keep the portion size the same. So you're not necessarily increasing the volume of the food they're eating, but you're increasing the nutrients to make it really nourishing for that person. So a basic food first plan that you might put into place if you're noticing someone with nutrition problems. So you'd want to try and encourage a little and often approach. So, you know, they might not be able to eat large meals all at once. So lots and little snacks, nourishing drinks and things like that throughout the day. So 3 small regular meals per day. Fortifying meals with extra nutrient-dense ingredients, like I said earlier. So things like skim milk powder, cheese, yogurt, cream, butter, oil. So these are things which are high in fat and high in protein, hopefully as well. And they will just sort of help to bulk the diet out and make it kind of more nutrient dense. We also have ideas for some plant-based food fortifiers as well on some of our resources on Knowledge Anglia. So you have got someone that's sort of vegan or vegetarian, there is other options you can use as well, not just animal products. Include puddings if the person likes puddings. Try and have nourishing drinks as well. So between meals, try and make, you know, a hot drink or a cold drink, which is maybe milk-based or something like that, which has got lots of protein and calories in it. Try and use a pint of fortified milk every day if possible. So this could be part of your nourishing drinks. And fortified milk is 1 pint of whole milk, so full fat milk, mixed with 4 tablespoons of skim milk powder. Skim milk powder is really cheap, cost effective. You can get it from the supermarkets. You would use 4 tablespoons of that, mix a tiny bit of the whole milk in to make a paste, and then fill it up with whole milk. Put that in the fridge and use that throughout the day. So that can be used in anything that you would normally use milk in. So the nourishing drinks I discussed earlier, making up custard, mashed potato, making cereal and things like that. So that's really good. And if you can use a pint of that in a day, that will provide an extra 600 calories and 40 grams of protein. And then one of the questions that we had leading up to this presentation was about dysphagia and swallowing difficulties and the adaptations to make there. So I haven't got time to go fully through the kind of IDSI swallowing guidance today, but I would urge you to familiarise yourself with that, because people with dysphagia, we can really sort of alter all of these ideas here to be suitable for those people. So really important that people with dysphagia also have access to snacks and nourishing drinks and food fortification. But there's lots and lots of things you can do in order to get those ideas in for people with dysphagia. So supporting good nutrition and hydration, this is, you know, for everyone, not just people with malnutrition. So really want to make sure it's an individualized approach depending on the person that you have in front of you, using preferred foods and drinks, taking taste changes into account. So, you know, if there is a preference for things like sweet foods, maybe trying a few things to make, you know, savoury foods a bit sweeter, using sweet condiments and sauces, extra flavourings to stimulate taste. If they like puddings, then making sure, you know, if that is a very reliable way of getting someone to eat and drink, you know, they might leave a lot of the main course and really just focus on the pudding. You can make sure that pudding is really nourishing. So using milk-based puddings or puddings which are made with ground almonds and things like that. So that will have lots of protein in there and make sure they're getting lots of nutrients. Also sweet vegetables as well, particularly root vegetables are really good. Roasting vegetables to bring out that sweet flavour. Be flexible, so really important to, you know, allow unusual combinations and be flexible with people. So they might not necessarily eat their main course and then their pudding, you know, they might want to mix and match things, and that's absolutely fine. Give enough time for meals as well. So some people might be quite slow eaters, so really important to give them enough time to get all the nutrients that they need in. Preferred eating environment or company as well. So as I mentioned earlier, making sure that person is eating where they want to, with the people they want to. Some people with dementia really find it useful to watch other people eating so they can sort of copy, because sometimes it's really difficult for them to initiate that kind of eating or getting mouthfuls and spoonfuls of food. So sometimes watching other people do it is really, really beneficial. Using preferred plates, cups and cutlery, so particularly with drinking, making sure it's the right weight, the right grip and things like that is really important. If they're finding cutlery quite difficult to use, thinking would it be easier for them to, you to chop up the food or perhaps give them a spoon to use as well. So encouraging them to be as independent as possible within their own abilities. So ensuring comfort and independence of each individual with dementia at mealtimes is really, really important. So the comfort side, you could encourage the person to use the bathroom and make sure that they're comfortable to be sitting there for as long as it takes for them to have their meal. Good oral hygiene as well. So, I was explaining earlier about the barriers to eating and pain and things like that. So dental pain, oral pain is a really kind of common thing in older age, particularly, if they have dentures and things like that. So making sure oral hygiene is really good to prevent those problems, making sure they're wearing their dentures for their meals and things like that. Encouraging choice within that person's ability, so where to sit, what to eat, what to drink, but sometimes maybe needing to keep it a bit simple as well. If they can't kind of make a complex decision, giving a couple of options or 3 options and making it sort of, doable for that person. Involving them in preparation of food and drink if they're able. So, some people might have always run their household and done all their own cooking and things like that. So it might be really nice for them actually to be involved and to have that kind of experience and maybe trigger some memories as well for them about making certain things. Ensuring any symptoms are managed and preparing for spillages in a dignified way as well. If people are a bit messy at meal times, that's absolutely fine. But wearing an apron, wearing a serviette and things might be a bit undignified for some people. So making sure you have the ability to sort of clean up in a dignified way and make them presentable to be eating with other people if that's what they want. Okay, and then just lastly, just a few hints and tips to help you with those people with dementia. So there's been lots of studies to look at different types of plates and cups to use, and what they found is that using a plain bold primary coloured plate or cup might be quite useful for people. It really helps that food stand out visually on the plate. Some people with dementia, as we said earlier, have some kind of sensory issues, so things like patterns on plates or cups and things like that can be quite distracting, and actually people can start interacting with those patterns, so trying to pick them and things like that, and it does focus the mind if they have something like a nice plain coloured plate which makes the food stand out on. Keeping a drink within reach at all times as well is quite good, so that they're reminded to have a sip of fluid throughout the day and regular intervals. If it's people in their own homes that you're supporting, a really good tip is to kind of make sure foods and drinks are easily accessible. So using things like putting things in clear containers so they can easily tell what they are, pre-grating cheese and slicing cheese and things like that, so it's really easily accessible, ready to make a sandwich or put on beans and on toast or something like that. Again, if they're going to be preparing foods on their own, so adding reminders and instructions as well, particularly things like ready meals that might be useful for. And then the mealtime experience, trying to kind of link that meal or that food to memories as well. So maybe making special foods or making an event out of certain foods which might trigger memories in their past. And in that same vein, sort of making mealtimes a social occasion if that would be suitable for that person. So involving friends and family and special events would be really nice for some people to make it a nice, enjoyable occasion.
Thank you for watching. If you would like more information, please visit Norfolk and Suffolk caresupport.co.uk, where you'll find further training on our learning portal. The link for this website is in the description down below.